People ask me all the time, how do you really know you've done over 12,000 surgeries? And to be fair, it's a good question. A lot of surgeons will throw numbers around. They'll say, I do 800 a year, I do 1,000 cases a year, I do 500 cases a year. But you know what the real truth is? Most don't really track them. I do, and I always have. And how do I know that? Because of this. And this. And this. It's the books. And this. And this. Most surgeons never keep a record of their written cases, but I always have, tracked in these books. Every time I do a surgery, I leave with stickers in my hands. And when I get home, I track my surgeries. And here they are, grouped by 100 cases at a time, layers after layers of paper clips. Every patient logged by hand for 25 years. And I did this in my residency too. What it doesn't include are cases where I've gone and proctored other surgeons. So I've done actually many more cases than this since I've been in practice. These are just mine. So these books, they're not decorations. This is my career. Each one represents years of work, thousands of decisions, tens of thousands of moments where someone trusted me with their body. That's how I know I've done over 12,000 surgeries, because I was there for every single one of them. My first books, ADC. My first 3 years were at Austin Diagnostic Clinic. I had just finished my fellowship at the University of Utah. I was hungry, focused, and honestly, still figuring out who I was as a surgeon. But at ADC, I learned how to build a practice. I learned humility. I can still remember my first patient, and I can still remember my first patient complication. Surgical judgment, I learned that at ADC. And that volume alone doesn't make you good, it's reflection. Reflection makes you good. Those early years taught me how much responsibility this job really carries. I spent many nights pacing around my house in the middle of the night, worried about my patients that time. And the next step for me in 2007 came Texas Orthopedics. 14 years. A fantastic, great group, incredibly busy, outstanding colleagues to work with. This is where the reps came in for me, 7,609 to be exact. The days were long, the cases were heavy, and the pace was relentless. But I learned efficiency, and I learned consistency, and I learned how to take care of a lot of people really, really well. I built relationships I still value deeply, and I did a lot of surgery. And then finally came Austin Orthopedic Institute. The shift started here, actually. Here you go. November 2nd, 2021. More books. So what happened at the Austin Orthopedic Institute? Last 4 years? Well, this was different. By this point, I wasn't just a surgeon, I was more of an entrepreneur. I had started to feel a pull to do something and try something different, to control more of my patient experience, and a sense that while the volume was high, the philosophy wasn't fully aligned with where I was headed. There's nothing bad against my old group, nothing dramatic, it was just my growth. Sometimes you don't leave because something's broken, you leave because you've outgrown it. And I had outgrown my experience there. And every step of the way, I was blessed to be busier, more successful, and trusted with more and more surgery. But here's the part people don't expect. There comes a point after 25 years and 12,000 surgery where the question isn't how many more can I do? It's how well do I want to do them? The hamster wheel that we're on is real. More cases, more volume, more pressure, it greets us year after year after year. And at some point, that doesn't serve the patient or, quite frankly, the surgeon, me. So, where am I now? I'm at a stage in my career where I want fewer surgeries, but higher quality ones. More time, more listening to patients, more attention, more presence. Not because I can't do the volume anymore, I still have it in me, but because I don't want to. Experience gives you the privilege of choice. And after thousands of cases, you realize excellence isn't about doing more. It's not about the volume anymore. It's about doing the right amount of volume really, really well. So these books represent a lifetime of work. They remind me where I came from, what I've learned, and why I'm choosing a different path now. This isn't slowing down, it's just leveling up. And that's exactly where I'm supposed to be. If you're an orthopedic surgeon watching this and thinking, I felt that way too. If you've built a great career, done thousands of cases across years and years and decades, and you're starting to wonder what the next chapter looks like, you're not alone. I've been there. Many of us reach a point where volume no longer equals fulfillment, where experience creates a desire for ownership, alignment, and a different way to practice medicine. That's why I founded NAOCA. NAOCA exists to help experienced orthopedic surgeons transition into an entrepreneurial, concierge-based model without losing your identity, your standards, or your integrity. If you're curious about what that could look like in your own career, I invite you to learn more. This chapter doesn't have to be about the end. For many of us, it's about beginning something better. Visit me at orthopedic-concierge.com or email me at founder@orthopedic-concierge.com, and we'll have an honest discussion, surgeon to surgeon, about what's next in your career.